All right, today we're doing a deep dive into an alternative protocol for erectile dysfunction. We're going to go way beyond the surface level stuff you usually hear. We're going to get into the real science of the root causes, uncover why the standard treatments often feel like a band-aid, and, most importantly, lay out a complete systems-based strategy that actually addresses the core of the problem for real lasting results.
You know, if you've looked into this at all, you've probably seen those official-sounding statements, the ones that say there's no clinical support for natural therapies. Well, the source material for this explainer calls that idea what it is, and I'm quoting here, absolutely a lie. The truth is, there are a whole lot of randomized, controlled human studies on these alternatives, and they don't just show minor effects, they show significant, measurable improvement. And that research, that's the bedrock for everything we're about to get into today.
Before we jump in, don't forget to like, share, and subscribe, and check out the links in the description if you're looking for a real estate agent in your market or you need life insurance. My team and I can help you anywhere nationwide.
So what's really going on behind the scenes with this condition? I'll tell you, the number one mistake people make is thinking it's all about low testosterone. The reality is you can have a totally normal, even an optimal T level, and still have major issues. The real story here is much deeper, and it's not really about hormones at all. It's a story about the health of your entire vascular system.
Okay, here's our game plan for this explainer. First, we're going to redefine the problem. Then, we'll unmask the true root cause. After that, we'll talk about how to boost nitric oxide naturally, look at some targeted herbs and supplements, lay out a foundational lifestyle protocol you can't skip, and finally, we'll cover some high-impact interventions that are proven to work.
So let's kick things off with Section 1, redefining the problem. And I can't stress this enough. This first step is absolutely critical. Because if you get the diagnosis wrong, if you're aiming at the wrong target, none of the solutions are ever going to hit the bullseye. For most people, the way they think about this is just incomplete.
This right here, this is probably the most important thing you'll hear today. This condition is one of the first, most accurate warning signs of a system-wide vascular disease. People call it the canary in the coal mine for your heart health. See, years before a heart attack or a stroke might happen, this issue can pop up because the blood vessels down there are smaller and more sensitive, so they show damage much, much earlier. At its core, this is a blood flow problem. It starts in that super delicate, one-cell-thick inner lining of your arteries, a layer called the endothelium. When that lining gets damaged, your entire cardiovascular system is in trouble.
So what's the magic ingredient that makes this arterial lining work? Well, the hero of our story is a tiny little gas molecule called nitric oxide, or NO. Just think of nitric oxide as the master signal. It's the messenger that tells the muscles in your artery walls to just relax. This process is called vasodilation. It makes the arteries open up wide, letting blood rush through freely. It's the difference between water trickling through a tiny straw and blasting out of a fire hose. And for an erection to happen, you need that powerful, unrestricted blood flow. It's not optional. To give you an idea, in animal studies, when they completely block the production of nitric oxide, it causes a total failure to get an erection. It's that fundamental.
Now, just take a look at these numbers. This is a real wake-up call. It shows just how dramatically our body's ability to make nitric oxide nosedives as we get older. In your 20s, you're at peak performance, 100%. But look at that drop. By your 40s, you're already down to about 70%. Fast forward to your 60s, and you might only be making 40% of what you used to. And by your 70s, it can crash all the way down to 25%. This natural decline is a massive, massive factor because that fundamental signal for healthy blood flow just gets weaker and weaker over time.
So this brings us to the little blue pill and its cousins. Now here's a huge misconception. A lot of people think these drugs somehow make more nitric oxide. They don't, not at all. Here's what's actually happening. Your body makes some nitric oxide, and then an enzyme called PDE5 comes along and cleans up, breaks it down. What these drugs do is block that enzyme. So think of it like this. They aren't turning up the water in your sink, they're just putting a plug in the drain. It helps you hang on to the little bit of nitric oxide you have for a bit longer, but it does absolutely nothing to fix the fact that the faucet is just barely dripping. The key thing to get here is that this is symptom management, not a root cause solution.
And because these are pretty powerful drugs that mess with your blood flow everywhere in your body, they can come with a whole list of side effects. Sure, some are minor, like headaches or getting flushed, but there are more serious risks too, like a dangerous drop in blood pressure, an increased risk for heart attack or stroke, permanent hearing loss, that weird side effect where you start seeing everything with a blue tint, and even painful prolonged erections that can cause permanent damage. This risk profile alone is a pretty good reason to look for safer alternatives that actually fix the problem. So to wrap up this first section, the problem isn't testosterone, it's your vascular health. The key player is nitric oxide, which drops as we age, and conventional drugs just slow its breakdown. They don't fix the supply issue.
Okay, so let's move on to section 2, uncovering the true root cause. We've figured out that declining nitric oxide is the how, but what's the why? What's the real villain in this story that's actively wrecking our vascular system in the first place?
Well, the elephant in the room. The primary thing driving this long-term vascular damage for the vast majority of people is a metabolic problem called insulin resistance. And no, this isn't just about diabetes. This is a condition that sneaks up on you, developing silently over decades. It's tearing up the lining of your arteries long before a doctor ever mentions pre-diabetes. And it's not just this one issue. It's the root cause of so many modern health problems, from that stubborn belly fat you can't lose, to high blood pressure, to brain fog.
So how does this happen? It's like a slow-motion train wreck that starts when we're young. It begins with a diet packed with sugar and refined carbs. Soda, bread, pasta, breakfast cereal. Every time you eat that stuff, it causes a huge spike in the hormone insulin. Now, insulin is supposed to be like a key that unlocks your cells to let sugar in for energy. But when you bombard your cells with these massive insulin spikes, day after day, year after year, they just get tired of hearing the signal. They become desensitized or resistant. At that point, insulin just doesn't work right anymore. The result? You've got dangerously high levels of both sugar and insulin floating around in your blood, creating this massive, system-wide inflammation that literally scars and damages the delicate lining of your arteries, destroying their ability to produce that all-important nitric oxide.
Now, while insulin resistance is public enemy number 1, it's also really important to know about other common factors. Certain widely used medications are well-known accomplices here. They can cause or worsen the condition by messing with your vascular health or nerve signals. We're talking about common antidepressants like SSRIs, beta blockers for high blood pressure, some diuretics, and a class of drugs called 5-alpha reductase inhibitors, the ones often used for prostate issues or hair loss. It's a critical piece of the puzzle to look at. So the big takeaway from this section: the primary villain is insulin resistance, which is driven by diet and silently damages your arteries for years. And on top of that, some common medications can make things even worse.
Okay, enough about the problem. We've defined it, we found the root cause. Now let's pivot to the good stuff, the solutions. Section 3 is all about boosting your nitric oxide production naturally, and we're starting with the two most powerful pillars of health there are: food and movement. When it comes to foods, some choices are just absolute superstars for cranking up nitric oxide. Why? Because they're loaded with natural nitrates that your body converts into NO. I mean, just look at this chart. Arugula is a beast. It can increase your NO production by over 200%. Beets are right there with it, and they're often easier to get in larger amounts, especially if you use a juice or a powder. Seriously, just a simple daily salad with some arugula and beets is an incredibly powerful move. Pomegranate is another great one, shown to give you about a 30% boost.
Now, beyond what you eat, moving your body is one of the most powerful, immediate, and totally free ways to get your nitric oxide pumping. A single intense workout can temporarily boost your levels by 80 to 100%. That physical stress on your artery walls, it's called shear stress, it's a direct signal to that endothelial lining to just release more NO. This is also a huge reason why exercise is so good for fixing insulin resistance. It directly opens up the blood vessels, improves blood flow, and helps get fuel to your muscles more efficiently.
But wait, not all exercise is created equal for this specific goal. The most effective types are things like high-intensity interval training, HIIT, and lifting weights. Those short, intense bursts of effort are like a power switch for nitric oxide release. On the flip side, long, slow endurance stuff, like training for a marathon, can actually be counterproductive sometimes. It can jack up your stress hormone, cortisol, for long periods, which directly fights against the vascular relaxation we're trying to achieve. So while a long walk is great, for maximum NO impact, intensity is king.
Okay, let's talk about a really smart supplement, L-citrulline. See, the direct building block for nitric oxide is an amino acid called L-arginine. The problem is, if you take L-arginine by itself, a lot of it gets destroyed by your gut and liver before it can do any good. L-citrulline is a clever workaround. It takes a different route, going straight to the kidneys where it gets converted into L-arginine, completely bypassing that breakdown phase. What you get is a much higher, and more importantly, a much more sustained level of L-arginine in your blood, which leads to way more nitric oxide production that can last for hours. So to recap this section, eat your arugula and beets, do intense exercise like HIIT and weightlifting, and consider strategically supplementing with L-citrulline.
All right, we are about halfway through our protocol, so before we continue, don't forget to like, share, and subscribe. And if you need a top-tier real estate agent or help with life insurance, my national team is here for you. The links are in the description. Now, let's get back to it.
Let's move on to the next layer of our strategy in Section 4, targeted herbal and supplement support. We're talking about specific compounds from nature that have been studied and shown to have real positive effects on your vascular system and nitric oxide pathways.
This slide right here perfectly sums up the different philosophies. Remember our sink analogy? The pharmaceuticals work by plugging the drain. They stop the breakdown of whatever little nitric oxide you have. The natural alternatives we're about to talk about, they work on the other side of the problem. Their whole job is to turn the faucet on, to help your body actually increase its own production of nitric oxide. The goal here is to restore your body's natural function, not just put a Band-Aid on a symptom.
So let's look at some of the heavy hitters. First up, horny goatweed. Yeah, I know, the name is a bit much, but it's one of the most studied herbs for increasing nitric oxide. Pro tip, its active ingredient is fat-soluble, so taking it with a meal that has some healthy fat makes a huge difference in absorption. Next, Panax ginseng, another powerhouse. Studies show it both increases NO production and decreases its loss, with some really significant improvements seen in trials. Then you've got saffron. It gives you a mild NO boost, but it also has a positive effect on mood and neurotransmitters, which is great if anxiety or depression are part of the picture. And finally, ashwagandha. This is a classic herb for managing stress and lowering cortisol, and it's also been shown to increase both nitric oxide and testosterone. The key here is that all of these work with your body to restore its natural function.
All right, we've covered diet, exercise, and specific supplements. Now we get to what is, without a doubt, the most critical piece of the whole strategy: the foundational lifestyle protocol. And let me be perfectly clear, without these pillars in place, nothing else we've talked about is going to work long-term. This is the bedrock. Everything else is built on top of this.
These are the absolute non-negotiables. First, you have to aggressively fix the underlying insulin resistance. That means a low-carb diet. Cut out the sugars and the refined starches, period. Second, you absolutely must get 7 to 8 hours of high-quality sleep every single night. We'll come back to this. Third, get the inflammatory seed oils like soy, corn, and canola out of your kitchen and crank up your intake of anti-inflammatory omega-3s from things like fatty fish. Fourth, avoid alcohol and smoking. Both are just straight-up toxic to that delicate lining in your vascular system. And finally, make sure you're not deficient in key nutrient cofactors, especially zinc, vitamin D, and the B vitamins. They are all essential for making both nitric oxide and testosterone.
Now here's a really powerful, practical tip that connects your mind to your body. The release of nitric oxide is triggered by your parasympathetic nervous system. That's your rest and digest state. When you're stressed out or anxious, your fight-or-flight system takes over, and it actively shuts this whole process down. But you can consciously flip that switch. You can shift your body out of stress mode by just practicing slow, deliberate breathing through your nose. Seriously, just taking 5 or 10 calm, slow breaths can pull you out of a stress state, lower your cortisol, and help you maximize that crucial nitric oxide release. So to sum up this section, the foundation is everything. You have to fix insulin resistance, prioritize sleep, manage your fats, avoid toxins, get your nutrients, and learn to control your nervous system.
All right, we're in the home stretch. For our final section, let's look at some of the biggest impact interventions, the things that have been proven in clinical studies to make a real, measurable difference.
Let's start with a number that is just wow. This is from a controlled study. A full 40% of the men in the trial regained completely normal erectile function just by doing pelvic floor exercises, also known as Kegels. That's it. These exercises strengthen the muscles that not only improve blood flow to the area, but just as important, they help trap the blood in the area to maintain the erection. This is a completely free, simple, and ridiculously effective technique. And get this, another 34.5% saw significant improvement. That means 3/4 of the men in the study got major benefits from this one simple exercise.
So let's put it all together. This slide summarizes the most effective natural interventions across a ton of credible studies. Right at the top, no surprise, is a combined intensive lifestyle change, diet, exercise, the whole shebang. Number 2, we just saw the insane power of Kegel exercises. Regular aerobic exercise is also huge. Certain supplement combos have strong data, like L-arginine paired with pycnogenol, which is a powerful antioxidant that really boosts NO.
Panic's red ginseng shows up again. Niacin, which is vitamin B3, has also been shown to help because it causes vasodilation. And finally, and this is so important, treating underlying conditions like sleep apnea, which just destroys your vascular health overnight. Even things like acupuncture have been shown to help. The big takeaway is that a multi-pronged attack, hitting all these areas, is what gets the best results.
I want to end on what might be the single most important piece of advice in this entire explainer. We've talked about diet, supplements, exercise, all of it. But as the source material puts it so perfectly, and I quote, sleep is super, super important. If you're not sleeping at least 7 to 8 hours, then none of these are going to work. Sleep isn't just downtime. It's when your body repairs itself, regenerates, detoxifies, and rebuilds its supply of crucial things like nitric oxide. If you don't have that non-negotiable foundation of sleep, everything else we talked about today, it just falls apart.
So the final question is really for you. Are you ready to address the root cause and not just chase the symptom? Everything we've laid out today is about making a fundamental shift in focus, getting away from the temporary quick fix, and moving towards systematically rebuilding the foundations of your vascular and metabolic health for long-term, sustainable results that last.
If this deep dive into vascular health and fixing the root cause was valuable for you, please do me a favor and like, share, and subscribe for more explainers just like this one. And for help with other big life decisions like real estate or life insurance, my national team is standing by to help. You can find all the links you need down in the description. Thanks for watching.